Welcome back. Experts at Alabama Pain Physicians say leg pain is one of the most common pain complaints. Here to tell us why or where this may be coming from, we have Dr. Ty Thomas here. We appreciate you joining us.
Thanks for having me.
Absolutely. So we're talking about leg pain and specifically pain caused by a vein problem. What does this feel like?
Yeah, so leg pain, typically, normally we think about it coming from the back is kind of typically how we think of it. So it can come from the spine, it can come from your joints, it can come from muscles. So we think of arthritis in the knees and hips.
Right.
But there's two really common types of pain that just kind of go unrecognized. One of them is with the venous system, where the veins, where they don't work right. And the other one is this abnormal deposition of fat in the legs that we see almost exclusively in women. Both of them have different types of approaches, but they're pretty significant and they go unrecognized, and so that's one of the things I wanted to talk about.
Right, so we were talking about lipedema, right? That's one of those diseases you were mentioning.
Right, so lipedema, so lipid, fat, edema, swelling, and so it's, you see it in the legs, it's the fat, abnormal accumulation of fat in the legs, it's usually symmetric. But what's interesting, it doesn't include the feet, so we call it feet sparing. And so we see it as kind of this pendulous type of fat. Sometimes we call it kind of the Michelin Man syndrome. And so it's that type of fat that just doesn't look right. And it's usually in women, the waist and below, and torso, everything else is usually normal. Necks are kind of thin. And so usually when you try to lose weight, you get skinny up top, but the lower part just doesn't. I mean, you continue to get fatter, but it's also a very painful condition that goes unrecognized.
Wow, so does it limit mobility?
It can. I mean, it limits the ability to ambulate just because it hurts.
Right.
And it doesn't hurt in everybody, but most of the time there's two different forms of it that hurt. But it's painful, so anything that's painful, especially legs, you're not going to want to do things. You're not want to get up and walk and do the exercises and those things.
Now, how can you correct this condition?
Well, so really, correction is something that definitely comes later. We want to first identify it, and so diagnosing it, we have to differentiate it between those other types of pain that can be in your leg, it may come from somewhere else, but also from vascular type of pain, which venous pain is a big one. So basically how we diagnose it and differentiate it is, we do some tests, physical exam. We also look at your legs underneath an ultrasound so we can see what the veins are doing, what the arteries are doing, and we can see if there's fluid in there. And then with lipedema or lipedema, it's typically no fluid, it's just that abnormal accumulation of fat.
Okay.
So once we diagnose it, which is different, then we can come up with a treatment plan that's pretty individual and specific, and they are different, they're quite different. But often these things all overlap. So usually if you have lipedema, you may have some issue with vein problems as well.
Right.
But you can also get secondary lymphedema, and that's kind of the typical swelling that most of us see and think of.
Okay. Dr. Thomas, really appreciate you coming on.
Thanks.
Fascinating, really.
Yeah, there's a lot to it. Thanks for having me.
Absolutely.